this administration looks at synergies. And we're able now for the first time to stop operating in silos where one ministry is doing something and the other ministry is doing. And what we do is we're able to put it together through a strong working team and a focus group to ensure that healthcare is a top priority for the government.
The PHA has my full support in the relocation of the Community Counseling and Assessment Center, a community-based arm of the Sandilands Rehabilitation Center, to a newly renovated and much improved site on Collins Avenue.
This is more than just constructing buildings or renovating the buildings. It's about the people that we serve. That's more important.
My mother was a nurse of 50 years and counting. I believe that the feelings I have and that I express in my public life are derived from my mother. And I believe her feelings of compassion for the people she served was passed on to me.
Hello, I'm Judy Terrell. Across the Bahamas, there's been national focus on harnessing the benefits of 21st century medical advances. This has given rise to broad reform across our public health sector. Across public hospitals and clinics, a transformation is occurring. That transformation is part and parcel of an aggressive health system strengthening program designed to ensure that every citizen in this country has equal access to quality health care. It also comes ahead of the implementation of national health insurance, which seeks to provide universal health care for all Bahamians.
The evidence-based information is clear that there's some 180 to 200,000 Bahamians who do not have insurance, and there's a large cross-section of individuals who don't even access essential primary healthcare services. With the launch of NHI Universal Primary Healthcare, every citizen in the Commonwealth of the Bahamas will access these basic services with no cash at point of service, which means that individuals who may not have any money in their pocket can still access healthcare. And this is important to us because it is the first line of defense, and we can catch diseases before they become too advanced, and we can initiate protocols and medical treatments to prevent the chronic nature of diseases. And as a result of that, we can actually reduce the cost of tertiary healthcare throughout the country.
Major capital and infrastructural works have begun at health facilities and agencies across the country, all aimed at enhancing the delivery of health services in line with the standards of universal health care. Minister for Grand Bahama and Cabinet Subcommittee lead for the implementation of national health insurance, Dr. the Honorable Michael Darville, said the push to ensure these facilities are equipped to provide the entry-level requirements for an integrated health system, such as national health insurance, is critical.
With NHI coming on stream, there is a new requirement. Because we're going to improve the service, the quality of care, you have to have the infrastructure to the standard that will meet our clients' needs, and at the same time be able to provide the services and the technical support within the clinic in order to ensure that the quality of healthcare is at NHI standard. So what we're doing is, throughout the country, both private and public clinics, speaking specifically to doctors to let them know what is the requirement to get the clinics up to standard. What we intend to do is we intend to be aggressive with our protocols, but at the same time allow the physicians to have an opportunity to come on board and to get their physical infrastructure as well as the technical support within the clinic to meet the digital requirement for NHI. As you're aware, we are moving towards the single medical record, and the single medical record means that the patient record can be accessed via the internet at the touch of the mouse. And so where we have our doctors going is to the point whereby their offices must become computerized in order to accommodate the patients who will have the ability to provide or to access services at a point of care without cash. And so now, for the first time in the country, we have Bahamians whose medical record can be accessed in a matter of a minute. If I'm traveling from Grand Bahama and I fall sick in New Providence and I go to the doctor to provide services for me, the doctor can access my record. And so the doctors and the physical infrastructure must be at a point where this can happen. What we intend to do is, as far as the IT is concerned, most of the government clinics, the particular ones that we're dealing with, about 29 of them, we're going to put the necessary IT infrastructure in place where our doctors will be able to communicate with doctors in the emergency room, or even some surgical protocols can be dictated to the doctor so that we can prevent the high costs of moving patients back and forth when a physician on an out island or a physician on an out post will be able to see that patient and to be able to communicate with a specialist who can assist the family physician or the general practitioner to bring support and to resolve the problem right at where the point of care is.
But in the Bahamas, the implementation of national health insurance is no new topic. For Darville, however, the means by which the government will achieve it is.
I'm the Minister for Grand Bahama, and I am one of those ministers who my whole ministry revolves synergies. In order for me to be effective, I must communicate with the Minister of Health. In order for me to be effective, I must communicate with the Minister of Tourism. And it goes around the table. It's been a very unique experience, and I believe it's a very positive experience, and it will definitely create a new approach for governance. And I believe the Prime Minister, in his wisdom, understood after 40 years of experience working in different ministries at different levels, he clearly understands that the time is gone where we operate in our own domain and focus on one area. The time has come now for all of us to be fully in tune with what's happening in the country and utilize all of the resources, our technical expertise, as well as our ministerial portfolios for one thing only, and that is for the country to grow. The days are gone where ministries operate in silos. It's important for us to be able to communicate with each other so that we do not waste public resources by duplicating services. And so by ministries being closely interconnected, even with our IT platforms to be able to communicate, it improves the efficiency of governance, and it also reduces the costs of providing services for the Bahamian people. And so what you're seeing now with the launch of NHI, where the PHA is involved, where the Department of Public Health is involved, where the Ministry of Health is involved, the Ministry of Works, and look at me, the Minister of Grand Bahama, even involved. We are one living organism.
Setting a clear example that the playing field will be leveled in the delivery of care via national health insurance, he said, is evidenced by the deliberate focus on our far-flung islands.
We're leveling the playing field across the country, and we're bringing equity to our Bahamians, whether you're in Inagua all the way into Grand Key, and to ensure that we upgrade these facilities so that the quality of care does not become Nassau-centric or Grand Bahama-centric, but we are able to provide relatively good quality services, primary healthcare services, throughout the Commonwealth of the Bahamas. And so our thrust for healthcare strengthening is to demonstrate, first of all, to the Bahamian people, but those who live in the family islands, that national health insurance is not Nassau health insurance or Freeport health insurance, but it is for the entire country.
According to the minister, the implementation of national health insurance in the Bahamas has garnered the attention of countries in our region, some of whom, he said, are aware of the massive amounts of research that has gone into implementing national health insurance in the Bahamas, and who are fully aware of how challenging it might be in an archipelagic nation such as ours.
Many of our neighbors, particularly our CARICOM countries, are watching the Bahamas very closely to see how successful we are with the launch of national health insurance, with the first phase being universal primary health care. They have already been to our country to look and to speak with some of the consultants to see how far we are and to try to ensure that they follow suit. Universal health care is a must for the Bahamas. It is essential that we implement it, because if we don't, over the years, the healthcare costs will continue to balloon, and it will be not accessible to much more people throughout the country. And so for all of us who have been pushing very hard, the Cabinet Subcommittee, all of our technical support, all of our consultants, we're here to demonstrate to the world that the Bahamas is ready for national health insurance, with the first phase being universal primary health care, so that we can definitely now take charge of diseases that can potentially become chronic and reduce the incidence of non-communicable diseases. That is really the main thrust that is eating up a lot of the healthcare budget and consuming a lot of the beds in our tertiary institutions.
Built as a main pillar of the successful implementation of national health insurance, the Health System Strengthening Initiative comprises 8 areas which seek to employ specific interventions and corrective actions in order to accommodate the demands of NHI. These include improving the physical environment of our nation's 3 public hospitals and community clinics nationwide, reducing patient wait times for care, extending the hours of service at clinics and pharmacies, reducing outages of essential drugs and other medical supplies, improving information management systems, improving customer service and patient care, improving patient education, and enhancing community outreach services. Critical to the improvement of health services has been the upgrade and renovation to tertiary facilities. At the Princess Margaret Hospital, contracts were executed in 2016 for major renovation works to the existing structure. Managing Director at the Public Hospitals Authority, Mr. Herbert Brown, said the comprehensive overhaul of the nation's premier hospital began with the construction of the new state-of-the-art critical care block. That facility, he said, has already earned the status of being listed among the best in the region. For Brown, it was a major starting point in the health system strengthening agenda, as 5 months after the opening of the new block, the PHA signed a contract with the Beck Group, headed by Bahamian CEO Fred Perpall, for a master plan for the development of the existing hospital. It would only be a matter of months before official contract signing events would signal the start of comprehensive renovations to the maternity ward, male surgical wards, and accident and emergency department at the Princess Margaret Hospital. Much of the work engaged at the Princess Margaret Hospital, Managing Director Brown said, was done with the full recognition that the Princess Margaret Hospital was constructed in 1953.
Because of the age of our infrastructure, there's some infrastructural work that we have to do. For example, we have to upgrade the firefighting equipment in the Princess Margaret Hospital. We have to upgrade our plumbing, our electrical, IT, etc. All of that will happen within this project. Additionally, as a part of the maternity project, we will also focus attention on the physical infrastructure insofar as Surgical 1 and 2 is concerned. And while we are doing these renovations, consistent and in compliance with NHI, we will seek to ensure that no ward going forward in the future will have more than 4 patients that will be accommodated. That is to ensure that there's a greater level of privacy than we have now, where you walk into the Princess Margaret Hospital or the RAN and you see an open, what we call the Nightingale ward style with 14, 15 patients. That will no longer be the case going forward.
The same would be mirrored in Grand Bahama, where the PHA undertook the renovation of all clinics on the island, with the West End Clinic acting as the model for future clinic upgrades. The clinic's modern concept includes additional triage, examination, and treatment rooms, dental suites, a trauma area, staff training area, on-call and ready rooms for EMS staff, increased accommodations for nurses, and a 24-hour ambulatory service. At the Rand Memorial Hospital, the PHA issued contracts in September 2016 for the refurbishment of the existing structure. The hospital, which was originally built in 1960 as a clinic, has outgrown itself. The PHA, according to the managing director, has now set its sights on a new hospital for Grand Bahama, which will begin with the construction of the new state-of-the-art Freeport Community Clinic. In the interim, he said, the necessary upgrades to the existing hospital will take place.
Now, what is important about that construction is the clinic is being constructed on the site of the new hospital. Because what we are seeking to do is to remove patients who do not need to be in our accident and emergency into an environment that will do a couple of things. One is that when we treat patients in the accident and emergency, it's costly, but more importantly, because it is an emergency department, if an emergency comes in, that emergency is going to be given priority. So what we will do now is that those patients who are presenting with non-emergency will now be able to go to the clinic. It's right on the same site, and so it will make a significant difference in the quality and the delivery of the service we provide. So at the RAN itself, in the interim, while we await for the construction of the new hospital, we will do some upgrading. If you know the RAN hospital, you will know that the kitchen and the cafeteria sits in the middle of the wards. That is unacceptable for several reasons. One, it's a safety problem, and two, it's in the middle of the ward, so it makes it difficult for patients having to walk to passing the clinic, and it makes it very difficult. The wards, and it makes it very difficult. When the kitchen and the cafeteria is relocated to its new premises, we will then be in a position to use that space for 2 4-bedded wards. And again, based on the specifications, we are not going to have wards constructed where more than 4 patients would be included. So that's the kitchen and the cafeteria. For the first time in the RAN's history, we're going to have an 8-bedded private ward. And so those patients who would wish to have a private room will now, within the next, I would say within the next 6 to 9 months, will be in a position to see the private suite and will be able to be accommodated in a private room.
One of the positives that has come out of Grand Bahama in the Health System Strengthening Initiative has been the success attributed to the extension of clinic hours. In the first 3 months of implementation in the final quarter of 2016, the Rand Memorial Hospital saw an 18% decrease of A&E visits as residents were using the services at the 8 Mile Rock Clinic, which extended operating hours to 9 p.m. This, according to the PHA Managing Director, will become even more common at clinics across the country.
I remember several months ago, I had an opportunity while I was in Freeport to visit the 8 Mile Rock Clinic. And there was a 70-year-old man who was seeing the doctor at the time. And he recognized me and called me to talk. I went over to him. He says, "Mr. Brown, you do not know what this means to me." He says, "I'm an old age pensioner, and frequently I had to travel to the RAN, accident and emergency, to see the doctor." He says, what that did means that I had to use my old age pension when I couldn't get a ride to get some form of transportation to get into the hospital. But now I live almost across the road from the clinic. I could walk over to the clinic. He says, "You do not know what this means, not just for me, but for the community." And so we are going to look further at extending our clinic hours, not only at the 8 Mile Rock, but we are also looking, when the new clinic is constructed, that will be extended hours. But we are also potentially now looking at the Hawksbill Clinic to extend the hours. Right now, we are extending the hours up to 9 o'clock, but we are looking to go beyond 9 and potentially up to 12 and even beyond that. And so that's going to make a difference.
Emergency medical services have also been given an overhaul, with 10 new ambulances added to the fleet in May 2016, the focus of which is to reduce the wait times for ambulances responding to an emergency.
The Emergency Medical Services of the Public Hospitals Authority, we are making tremendous strides. Presently, our response time is not what it ought to be. If we are looking at international standards is between 8 and 10 minutes from the time you receive a call and the time you respond. Well, we are at now about half an hour to respond to a call. It is our aim to reduce the response time to between 8 and 10 minutes. As a direct result of that, what we are seeking to do, because a lot of the ambulances that we have today are rather old, and so we are upgrading our complete fleet that is going to make a significant difference, because we will now be able to replace some of the old vehicles that we have. But more importantly, we are now going to be able to decentralize the service. Rather than a vehicle having to respond from the base on Collins Avenue, we will have ambulances deployed to the Elizabeth Estates Clinic, to South Beach, and to the Flamingo Gardens Clinic here in New Providence. So if you live in South Beach and there is a need for an ambulance, well, we will have an ambulance 24 hours stationed at the South Beach Clinic to respond to your call. And so at the end of the day, we feel that is going to make a significant difference.
February 2016, the Public Hospitals Authority signed an agreement with International Medix Limited Liability Company for $7.5 million worth of diagnostic imaging services in order to expand and upgrade the capacity ahead of the implementation of national health insurance. The equipment included 2 MRC scanners, 2 64-slice CT scanners, 1 16 CT scanner, 4 digital radiography systems, 2 radiography or fluoroscopy systems, 3 mobile X-ray units, and 6 ultrasound scanners. The equipment not only replaces aging equipment at the country's 2 main hospitals, but also allows for the full digitalization of the Princess Margaret Hospital in New Providence and the Rand Memorial Hospital in Grand Bahama.
For the first time in the history of the public healthcare system, we are going to have a new 16-slice CT scan and an MRI at the Rand and at the Princess Margaret Hospital. Now that makes a significant difference, because I know of patients that we've had to assist financially to go outside of the country, and even in some cases, of course, they've gone to facilities here in the Bahamas. Well, with our own equipment, we're going to make it much easier for patients to be able to have that high level of care where we didn't have in the public service. So a lot of things are happening, not only at RAND, but throughout the public healthcare system.
Improving on the procurement and distribution of drugs and medical supplies was also a key factor in the health system strengthening initiative.
The authority conducted a comprehensive exercise to identify deficiencies with a specific focus on where and why they occurred and the best solution for mitigating against continued incidents. The solution would be to consolidate the Bahamas National Drug Agency and the Materials Management Directorate under one management structure. That structure would be charged with ensuring better management and accountability of drug and medical supplies of hospitals and clinics across the country.
So at the end of the day, I want to know that the drug that the patient needs is always available, because there are items that we must never ever run out of. And so that's going to make a significant difference. We have engaged and will be engaging additional staff so that we are monitoring on a daily basis. Not what is happening in the warehouses, but what is happening on the wards, what is happening at the clinics. We are also putting in place, because if we don't have our system automated, we have a significant manual system now. And so what we are putting in place is an automated system which will not only allow us to be able to monitor the drugs within the warehouse, but going forward, we are going to be able to monitor the drugs that is distributed on the ward. So when the drugs is sent to the ward, we know how much we send. We will know at the end of the day what patient would have received the drugs, and we would be able to monitor from a central location how much drugs is on a medical ward. And that in itself is going to make a significant difference.
For Charlene Bain, Administrator of Community Health Services at the Department of Public Health, the upgrade of clinics across our archipelago and the construction of the new state-of-the-art primary, secondary, and specialist healthcare facilities in Exuma and Abaco reflect a long-standing vision for equitable access to healthcare in our family islands. That vision, she said, involved significant planning and paying specific attention to data and trends relative to Exuma and Abaco, as well as their surrounding communities.
One of the things about the Bahamian healthcare sector is that we have the ideal model of care, but we never really document and really truly articulate it. We have a blend of primary, public, and secondary healthcare services in this model of care that we have. So we went back and we looked at 5 years of data and looked at the leading cause for health visit to the facility, including those of the Exuma Keys and Ragged Island. We looked at reason for referral to hospital, and so based on the number of visits to the facility, the mortality and the morbidity rates and those causes, we then begin to look at the number of rooms and the scope of services, primary, diagnostic, and of course, recognizing that persons were being referred to hospital who didn't have to go. And so that's how we came up with a design for the facility. We've always admitted patients to our facility. It's just that we never had the diagnostic services to rule out a diagnosis, and so we had to send them into New Providence. But this facility represents what a primary healthcare facility ought to be.
Population, she said, was another key component in the planning. Bain used the Exuma facility as an example.
We looked at the fact that in the last census of 2010, Exuma population grew by 105%. It's a small population, but that is only the indigenous people. When you look at the fact that we have a growing, Exuma is the center of yachting in the Bahamas. One of the main centers. You have billions of dollars being invested in the Exuma Keys. You have millions of dollars being invested on the mainland. And so you have a transient tourist population of about 20 to 40,000 per annum. We have to look at the regattas, where you can have anywhere about 5,000 persons coming to regatta. We look at the music festival. And so when you look at the population, you have to design a healthcare facility to meet the primary as well as the emergency healthcare needs of the people. Not only in Exuma, but I keep saying it's for a regional approach or a local health system network approach.
In an unprecedented move, physicians, clinicians, and specialists earmarked to provide care at public health facilities across the Bahamas are being involved in the design of new facilities and the renovation of existing clinics. In Exuma and Abaco, it was much the same.
You know, when we begin to plan, we didn't just look at the local staff. We put all stakeholders who would be providing care in this facility, and that was the first, to have the specialist physicians. And you know, a lot of people, they like to see the glass half empty, but the team in public health always saw the glass half full. And so we met with the consultants and we said to them, this was the scope of services. What part will you play, you know, in providing care to the people? So we got all of them into the mix. And so we not only have the involvement coming on stream from our local specialist physicians and family medicine specialist physicians, but we also have a group of specialist physicians who are second homeowners in mainland Exuma and the Exuma Keys. In fact, the owner of Darby Island is an anesthetist, right? And so they are all been a part of this project development from afar. They have volunteered to provide their specialist services. We have Bahamians who have volunteered, persons like Dr. Raleigh Butler, Dr. Howell Munnings. And so we have Bahamian specialists who are very much interested in this project. And so looking at public-private partnership is important for the sustainability of healthcare services at this facility. We also look at health events or public health threats. And we know that we've had problems with malaria, which we have successfully managed. We know we have frequent events of illegal migrants coming, and in that case, they pose threats to the island of Exuma and indeed the country. And so we have a special room in there to deal with public health, population health matters, as well as disease surveillance. And so the data has led us to ensure that we make provision in the scope of services to address all, not just the chronic non-communicable diseases, but those infectious diseases that poses a threat. And this facility and the facility in Abaco are the only ones who have a proper triage room up front, so that when a patient enters the clinic or a client enters the clinic, they are accessed by the nurse before entering further into the facility. So if somebody was to present with measles, then that person is easily diagnosed, and we can put them into the isolation room. But more importantly, if you look at the other clinics, you have patients walking through the waiting room with a cup of urine. This one, this triage room, have all of the amenities or the equipment to provide for screening of a patient in a sense of privacy and dignity. There is a diagnostic bathroom within the triage room, so that persons can, like I say, can have their service in privacy and dignity. And that is a new design. And in all of the other designs coming up, that will be a feature of the new facilities.
Bain described her proudest moment about the achievement.
It took us 10 years to get Inagua and Grand Key. It took us 3 years to construct this. And this is what? Probably 6 times Inagua and about 10 times Grand Key.
Much of the physical improvements in Phase 1 of the clinic upgrades are designed to improve the access and delivery of health care across the Bahamas.
Never before in our development of healthcare have we achieved the selection and implementation of a universal platform that will be accessed by the clinics and services of the Department of Public Health and the public hospital institutions and facilities of the PHA. This, ladies and gentlemen, is a great day for the Bahamas.
The principal reason that I am pleased that our healthcare facilities on Grand Bahama will receive this system is because the northern region plays an important role in the growth and development of healthcare systems in that area.
We look forward to helping you to ensure that you have the right information and the right materials at the right place at the right time to provide better health care for your clients.
August 2016. The Ministry of Health and the Public Hospitals Authority executed an $18 million contract to purchase an integrated health information management system, or IHIMS, designed to digitally link all public hospitals and clinics across the Bahamas on a single platform. The proprietary technology automates key functions across the public health system, including patient access and identity management, health record information management, materials management, management report or business intelligence, general financials, including supply chain management modules, ambulatory and inpatient electronic medical records, emergency department information systems, critical care modules, document imaging, pharmacy management, and the radiology information system. When fully implemented, the new system, which has already been launched in New Providence and Grand Bahama, will connect all public clinics in the country, as well as clinics operated by the Royal Bahamas Police Force and the Royal Bahamas Defense Force, as well as the Department of Corrections. Public Hospitals Authority Director of Projects, as well as Project Director for IHIMS, Philiberta Carter, said patients can expect greater efficiency and increased patient confidentiality as a result of the new system.
With this new integrated health information management system, it's going to be very transformative, because we are now moving into the era of an electronic medical record. And this particular system, from Allscripts and its strategic partner, Infor Lawson, will not just have one type of electronic record. It will have an electronic record that is specific to ambulatory services, that is, those services that are offered in our community-based clinics. It will also have an electronic medical record that is specific to our accident and emergency. And then there is critical care. And then the regular inpatient electronic medical record, which will allow even the specialties in the hospital, like your cardiology, your hematology, all of those specialties, orthopedics, so all of them will be able to document electronically on that patient's record. And so for the very, very first time, we're going to be seeing in the public healthcare sector a one patient, one record system, so that wherever that patient accesses care, their record will follow them and it will be available to them. And just to also let you know, we are not only focusing on the PHA and the Department of Public Health clinics, but the clinics of the Royal Bahamas Defense Force, the Royal Bahamas Police Force, and yes, the Department of Corrections. So truly, truly, in the government health sector, one patient, one record.
Added to the digital imprint in the health system strengthening model has been the implementation of telehealth. Described as one of the most revolutionary developments in healthcare, telehealth refers to the ability to provide and deliver healthcare services remotely through the use of information communication technology. It's a system that links healthcare professionals with patients to ensure they receive the care they need.
When we think about our mission to improve the quality of healthcare for patients, then in order to accomplish that, there's some things that you have to do. And one of them is to leverage health information technology, because it has the potential to do two things. One, to improve the quality of health for individuals, and secondly, to improve the performance of the providers who are delivering those care. Our primary focus is creating collaborative healthcare that is patient-centered. And so the primary benefit in all of it is to improve the outcomes. So in addition to improving the outcomes of our patients, though, we want to ensure that our physicians, our clinicians, can work in an environment where they can increase their productivity, but doing so efficiently. Health information management technology has the ability to leverage that for us.
With the implementation of the P2PC, or Patient to Physician Connect pilot study, completed at select primary care clinics in New Providence and Grand Bahama in 2016, Montino Roberts, PHA ICT consultant, lead consultant for telehealth implementation team, said already the ability to monitor in real time patients suffering from chronic non-communicable diseases via the technology is empowering patients to take a more active role in managing their own health.
So one of the areas that we looked at was one that had that we could affect the greatest change, and that would be with our CNCDs, so chronic non-communicable disease patients. That is your hypertension, diabetics, CHF, etc. So what we focused on was how is it we were able to real-time monitor those patients so we can be able to help them to be more compliant in their lifestyle, taking their medications on time, doing their healthcare plans on time, and then monitoring them to see if there's need for intervention so that we could avoid hospital admissions.
Drilling even deeper, there are visible signs that healthcare is taking on a new face ahead of the implementation of national health insurance, one that brings healthcare services to the community that were once confined to tertiary institutions. An example of this was the Public Hospitals Authority's move to relocate the eye clinic at the Princess Margaret Hospital to its new location at number 26 Soldier Road. The facility, which was renamed the Eye Care Center, now occupies 7,650 square feet in the former Eye World adjacent to Lowe's Pharmacy. Dr. Dawn Russell Hermans, acting head of division of the Ophthalmology Department of Surgery, Princess Margaret Hospital, said the establishment of the new Eye Care Center offers a unique opportunity to provide greater efficiency in service to clients.
Given the new location, we will be able to see more patients, and so we've brought on a lot more staff. We've had previously a lot of general ophthalmologists, but we now have a cornea specialist. We have 2 retina specialists. I'm a retina specialist, but we're getting a new one. And we also, hopefully by the end of this year, we'll also have a glaucoma specialist. So that will increase our ability to see a wide range of ophthalmic conditions. This has been a monumental move for the Department of Ophthalmology. In terms of increasing the volume of staff, we've also increased our volume of equipment, because a lot of things we did not have in the public system, we're going to have now. A lot of new things and new investigative procedures we're able to do, new equipment. It's going to be an exciting time because we're going to get to be able to offer more to the Bahamian public.
The Eye Care Center offers specialist ophthalmology services, including visual field testing, general eye exams, retinal care and surgery, cataract care and surgery, glaucoma care and surgery, cornea care and surgery, refraction and laser testing surgery.
I've had patients tell me that I have diabetes, but I didn't know it was going to affect my eyes, and that's big. And so we're going to not only be able to treat these patients, but educate these patients as well, and spread awareness about the fact that not just diabetes, but high blood pressure. A lot of times arthritis can give you problems in your eyes. There are lots of other conditions that can lead to vision-threatening problems that the Bahamian public needs to be aware of.
Hi, I'm Dr. Phyllis Davel. I'm a family medicine physician, and I've been deployed to San Salvador.
Hello, my name is Dr. Keisha Camille Smith, and I'm a family medicine physician, and I will be deployed to the island of Bimini.
My name is Nicole Adderley. I am a family medicine specialist with subspecialty training in skin conditions. I am deployed to the beautiful island of Exuma at the Georgetown Clinic.
I'm Dr. Alan Shaw. Basically, I'm emergency medicine physician. I've been deployed to the Berry Island under the government of Bahamas.
A family medicine doctor is a doctor that has been trained in family medicine.
So we have done extra training in the field of family medicine, which encompasses, they say, from the cradle to the grave.
In the Caribbean and in the Bahamas, the premier institution for postgraduate training is the University of West Indies. So we have undergone 4 years of intensive training, which included rotations through the major specialties and minor specialties. And also we did a research project studying the people and the residents of the Bahamas.
I was actually in internal medicine for 4 years before I decided to embark on family medicine. And working in the Department of Internal Medicine, you see a lot of chronic cases, chronic non-communicable diseases that come in through the hospital, and these are frequent flyers, people who have uncontrolled hypertension, people with uncontrolled diabetes. A lot of people who never even knew they had any issues of hypertension, diabetes, or even breast cancer until they present to A&E with a stroke or heart attack or whatever they may present with.
Non-communicable diseases is definitely a problem, not just in New Providence, but in all the Family Islands. And this is why we need physicians to go to the Family Islands to address these issues, to prevent certain diseases and to manage them early to prevent complications.
To truly combat the problem of chronic non-communicable disease, one has to attack it from the primary care base. I initially spent 4 years in the emergency room prior to entering the family medicine program. And so in the emergency room, we saw the end result. We saw the patients coming in with the heart attacks and the strokes. We also saw the patients who were coming in chronic renal disease and fluid retention. And a lot of the times, these patients were either didn't know they had the condition or they did not follow up. And so the tertiary care institutions are usually based on treating the end result, but we need to put our resources into the primary care so these patients can have better control of their high blood pressures and their diabetes and their elevated cholesterol, so we don't see the end stage of these diseases. The CNCDs are a big burden on the healthcare system For the most part, they usually present with little or no symptoms at the start of the disease, and when they do start to have symptoms, it's usually end stage, and it's very costly to the system. So it's wise to put your resources into the prevention and the early treatment than to put it into the management of the end stages.
I never thought that I would appreciate being a public health doctor, going to, as compared to the emergency medicine which I have been doing for most couple of years in my country. Because in emergency medicine, you see a patient, treat the patient, and after that the patient is discharged after you treat them. But when you get immersed on the clinic itself, you get to talk to the patient, not only with regards to their illness, but with regards to what they're feeling. There's a continuing service, not only in the clinic, but after they go back to their homes, and how they, it's like not only as a being physician, but as being as a friend to them.
The people of San Salvador, they should know that I'm a pretty down-to-earth person. I grew up in the Family Island, so I could relate to a lot. So they shouldn't have to fear me at all. I am just like anybody else. I can have jokes. Just treat me like, how you would treat anybody. So I want to be part of the community and be accepted. And because the more we can have open lines of communication, the more information I get from a person, the more we can work with to better that person's condition.
I'm a very caring person. I'm very passionate about what I do. I enjoy what I do. And that when they come to me, they can be reassured that they will be getting some of the best medical care I can offer to them.
I'm hardworking, I'm passionate, easy to get along with, and I'm here to serve them. I've been given an opportunity to serve the people of the Bahamas.
I'm just a very simple guy. I don't consider myself as a doctor, but as a friend to them. A friend in which they could always talk to, relate to, reach out to them, and at the same time be a professional doctor in treating the whole community with regards to their illness.
This is a part of nation building. It's a part of psychologically reassuring people in our country that we care, and that the professionals who will be out there have now been given this added help in being able to, with greater certainty, service their needs.
This has been Health System Strengthening, Transforming Healthcare. I'm Judy Terrell. Thank you for joining us.